Welcome everyone. Thank you for joining us today. I'm Teresa Marintet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today we are reporting an increase of 32 new cases of COVID-19 in Windsor and Essex County. Of the 32 cases, 8 are close contacts of confirmed cases, 1 is related to an outbreak, 8 are community acquired, and 15 are still being investigated. We have had 13,445 cases since the beginning of the pandemic. 12,763 cases are now resolved, and 281 people are active at this time. 38 cases have been identified as variants of concern, with 2 cases confirmed as the UK variant. 31 confirmed cases are currently in the hospital and 4 people are in ICU. Our community has now lost 401 people to COVID. We are reporting an additional 3 deaths from yesterday, all people from our community. 2 men in their 70s and a woman in her 80s have passed away. There are currently 14 active outbreaks in Windsor and Essex County. 3 in long-term care and retirement homes, 4 workplace outbreaks, 4 community outbreaks, 2 school outbreaks, and 1 hospital outbreak. I know we are receiving questions regarding our work with the Downtown Mission, who are experiencing a significant outbreak at this time, impacting over 100 people. We have been working closely with the Downtown Mission to develop processes and plans for their safe reopening. We have reviewed their plan and have provided feedback and are hopeful that we can work with the leadership of the mission to safely reopen in the coming weeks. Regarding our vaccination efforts for our seniors over the age of 80, we have now vaccinated 4,432 residents. We ask that people over the age of 80 continue to use our local health unit pre-registration system available on our website, or to call 519-251-4072 to schedule their appointment. To date, over 15,600 people have pre-registered. If you access the provincial system, which was launched yesterday, it will redirect you back to our local website. Our goal is to vaccinate all those 80 years and older by the end of this month. Please check in with your family and friends who are in this age group and help them pre-register if they have not already done so. To date, we have administered a total of 47,540 doses of vaccine in Windsor and Essex County. For more information about COVID-19 vaccines, please visit our vaccine webpage at wechu.org. Despite the vaccine rollout, please continue to follow public health measures. Stay home if you're sick. Limit your close contacts to household members. Maintain a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering. Cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app at canada.ca. Thank you.
We will now take questions from the media. We'll start with the Windsor Star.
Hi there. I just wanted to know if you could clarify. You said something about there were 38 cases, variants of concern. No, 38 variants of concern. I couldn't quite hear what you were saying about 2 cases. Could you just clarify that part of it?
So every test since February 3rd, every COVID test that goes to the lab, as of February 3rd, they are also tested for variants. So we have COVID-19, and then we have the variants, the mutations, the changes. So every lab test that goes to the lab gets tested for a variant. And in Windsor and Essex County, our cases since February 3rd that have been identified as variants are 38 cases in all. Of those, once a variant is identified, there is further testing that occurs, and it actually identifies the sequencing of the variant. So we know that 2 of our test results are determined to be UK variants. So you may be aware there are UK variants, South Africa, Brazil. So 2 of our variants have been identified as UK.
And I just read a report about the UK variant that they're now saying that it's even more deadly. At first they were saying it was more contagious than the initial virus, but now they're saying it's more deadly. Is that what are you seeing that here in Windsor?
We do know that the variants of concern, all the variants can spread very easily and also earlier, like when people are asymptomatic, they can spread quickly. And there's more severity with the cases. So if you are a high-risk contact of someone that has a variant, your whole household must isolate other than going for essential groceries. But locally, I'm not sure if we've seen that locally. We are managing the cases, and I don't believe any of our associated cases have been related to the deaths. Okay, and then I had another question about, you said your goal is by the end of the month to vaccinate everyone 80 and older. And do you believe that you're going to be able to meet that goal? Yes, because we have, as of March 22nd, which is already next week, we will have 2 additional sites. So right now, WFCU in Windsor, vaccinating exclusively people over the age of 80, and also in the Leamington Nature Fresh Farms Recreation Center, or the old Shirk Center. They're vaccinating 80+ seniors as well. And next week, Windsor Regional Hospital, the Sportsplex, will be vaccinating seniors, and the downtown Old Windsor Star building, they will be opening up us appointments at that site as well. So next week we'll have 4 options for our seniors to get vaccinated, and we believe we're on track to get everyone completed by the end of the month, for sure. Okay, thank you very much. That's all my questions.
Any questions from AM 800?
Good morning, Teresa. Just looking at the website and for the community outbreaks, I noticed that the Salvation Army is back on there after it was lifted over the weekend. Are these linked from the past outbreaks, or this is considered completely new?
They are back in outbreak based on another case. So this is a new outbreak.
Okay, and then with, I noticed the school outbreak at Bellwood has been lifted. I'm not sure if you have this number. I know you mentioned it yesterday, but the numbers we're seeing in schools, and like you mentioned, they're popping up in different schools. Is that obviously still a concern that we're seeing these many cases inside our schools?
Well, our staff are following up on the schools quite quickly and releasing cohorts. We know there is transmission in the community, so it's not surprising, but we are following up as quickly as we can and isolating high-risk contacts and making sure we take care of the school population. I know the surveillance testing, this was a question yesterday, I still don't have the answer though, but that started on the weekend. We don't have the results yet of the surveillance testing, but there are a lot of efforts in the schools to keep both the staff and the students as safe as possible. So the numbers are, what they are, but we try to address it as quickly as possible. And we have our nursing staff that continue to support the schools and make sure they follow up with the parents and the school staff as well.
And then one final one in regards to the outbreaks. I know Taylor asked this question yesterday, but do you have the number yet on how many cases the health unit is dealing with at the Southwest Detention Center?
All I can tell you is that I believe we identified 1 case, and in a institution like a correctional facility, 1 case is considered an outbreak. So in the schools, you may remember that two cases in a school where there's evidence of transmission is considered an outbreak. In other facilities, 1 outbreak that has been acquired in the facility can be is considered an outbreak.
And just to that point, sorry, can you tell us if it's an inmate or if it's a staff member at the jail?
Sorry, I cannot, and it's just for privacy, we're going to just leave it at one case.
Okay, thank you.
Any questions from CTV?
Hi, good morning. First off, I was just wondering if we ended up receiving an update from the province with how the pharmacy vaccine rollout is going.
There hasn't been any update other than that it's going very well, and that at all of the pilot sites. And we know that in Windsor it's going well as well. And you'll see that our numbers, even what I'm reporting today, significant numbers are attributed to the pharmacy rollout as well. So no further, no issues or concerns at this time.
Great. And can you speak a little bit to paramedics starting to vaccinate vulnerable residents in their homes instead of having them go kind of to the clinics there?
So Essex Windsor EMS is vaccinating under the directive of our medical officer of health, Dr. Ahmed. So they have the ability to vaccinate in the homes, but right now we are working with them to identify higher risk seniors that are in homes, and also our nurses have a small mobile team as well. I call them mobile because they're moving, they're the ones moving and providing on-site vaccination. So we're working with the, with some of these senior homes in the community to ensure that they have access to vaccinations. And some of the people are already vaccinated. They've been called and have gone to the WFCU or Leamington, but others have not. And so Essex Windsor EMS has the ability to do that, and they're doing a great job. They've started already. Our nurses have also started, and it's we're dependent on the vaccine, so we're carefully sharing our vaccine for all of these, different avenues that are getting released in our community.
Thank you.
Any questions from CBC?
Yes. The Ontario Hospital Association is declaring that the province is in a third wave of the virus. Do you agree from a local perspective that the third wave is here?
I'm going to have to defer to our epidemiologist to give us an informed overview of that, he's not here at this moment. But I did hear that last night, and I honestly can't comment. All I know is we're still in the global pandemic and doing the best we can, and none of the public health measures have changed. So whether we're going into a third wave or remain in this wave, the public health measures of staying home when you're sick, not going to work, even if your symptoms are mild, just do not go, because we're even finding people, as we interview them, they may have had a slight symptom that they just attributed to being like, oh, I just didn't feel quite right, but I still went to work. And so just don't do it. This is not the time to do that, and continue to limit your contacts. We're finding that people have more contacts than usual as well. So if you're limiting to your household members, and then as you go to work and come home, like really limit your contacts, and this will all help whatever wave we're in. So I can't emphasize that enough. Just continue to do what we've been all doing all along, but even, getting back to really doing a self-check and making sure you're doing your part.
Thank you. I also had a couple of questions regarding vaccine hesitancy among healthcare workers. Back in January, there was a survey done showing that a significant portion of seniors' home employees were delaying or refusing to get vaccinated. I think it was around 20%. I'm wondering if you've observed any shift in attitudes towards getting vaccinated among those working in healthcare, sort of as the rollout has continued and more information is being presented.
So access to the vaccine for healthcare workers is a priority. So anyone who wants the vaccine can still get the vaccine. And I know earlier on it was provided to the staff and residents of long-term care and retirement homes. And so all of those, we continue to provide vaccine in the retirement homes and long-term care homes. And staff can continue to get vaccinated. So when you're asking if we've seen that here, we don't have the all of the numbers of our healthcare workers. We do know with flu vaccine that typically people, the coverage rates in our community vary among healthcare workers. And so we want to make sure that as this vaccine, the COVID vaccine gets rolled out, there are more options, that people get vaccinated, whether you're a healthcare worker or not, but especially healthcare workers, they were offered the vaccine early on. They continue to be able to access the vaccine. And if they did not receive it and now want it, they have the means to get vaccinated.
But you haven't seen like any increase or decrease in the level of uptake among that population?
Well, what has happened is we've opened up the healthcare worker vaccination to others. So initially it was very prescriptive on who could get vaccinated. And now the healthcare worker definition is opening up a bit. And so you may have recalled that earlier on, it was very specific to people who were dealing with COVID positive patients and the interactions being very high risk. And then as we open up, and I don't have the document, but the ministry has a document where it talks about the highest priority of healthcare workers, and then the very high priority, the high priority, and the moderate priority. So for instance, vaccinators at vaccine clinics, they've been offered the vaccine, and you'll see as we get through the different priorities. So right now, our health unit is dealing with the very high priority, and then we'll move to the high. And I know it's so complicated, but we are trying to get as many healthcare workers in our community vaccinated when they're able to, because everyone's risk is a little bit different, even if you're a healthcare worker.
Thank you.
Any questions from Blackburn?
Nope, they've all been asked and answered. Thank you.
Any additional questions from the Windsor Star?
No, I'm good, thank you.
Any additional questions from AIM 800?
Teresa, you mentioned it already, but with St. Patrick's Day tomorrow, you talked about the message to the community about another question, but with St. Patty's Day tomorrow, just your message to the community.
Well, my message might not be welcomed, but again, stay home. The messaging has never changed, and I just think at this point, a year later, we all know what we need to do to minimize the spread and decrease any chances of transmission. And it really is to decrease your close contacts, stay home, wear a mask, physical distancing, all of those. Nothing has changed. So people will make their own decisions, and I know there are lots of opinions on what people are comfortable with, but the public health measures and the requirements under the Reopening Act are pretty clear. So I would just ask that people follow everything that's out there right now and get vaccinated when it's your turn.
Will enforcement levels be stepped up tomorrow?
We always have our tobacco and vaping enforcement officers working, and I don't know if they'll be stepped up because there's a certain amount of them. They'll continue to do their job, and we'll be out there.
Thank you.
Any additional questions from CTV?
No, thank you.
Any additional questions from CBC?
Two more. more, please. We're hearing that a farm worker died after arriving in Canada from Jamaica over the weekend. I'm wondering if you know anything about that and whether he had any connection to our area.
I don't know anything about that at all.
Okay, I also wanted to ask a bit more about the jail outbreak and the, you said that you couldn't provide more information due to privacy. Can you get into that a little bit more? Is this maybe coming from the province? I know the health unit provides specific numbers on all kinds of outbreaks. I guess my question is, what is different in this case?
When you're asking what is different, so all I know is that with the correctional facility, we have one case. So when you're saying we provide information, really the only other information in outbreaks that we provide is what's asked for us to disclose through the province, and it might be long-term care and retirement homes, staff and residents, splitting that up. I know in the Ministry of Education, they split up the students and the staff, but otherwise we don't typically get into real specific details, especially if the numbers are low. You could identify that person very specifically, and that is a privacy issue. So we're just trying to protect the privacy of people and share information that's needed based on exposures and awareness. And as you know, our health unit releases public exposures when there is a risk to the public. And at that point, we're giving more specific information, but I'm not sure what other information that would be helpful when we're investigating and working with organizations and workplaces and,
Well, I think it was, just mostly the case count and any sense of, how the outbreak is being managed or is going.
Yeah, and all I have to say is that since the beginning of the pandemic, any institution or agency, workplace, our health unit works pretty close with all of these different organizations to identify the outbreak, contain the outbreak, provide any advice, mitigation strategies. So we work really closely with all of the institutions, including the Southwest Detention Center. They are well versed and in a good position to deal with any issues they have in their cases, and we work closely with them to support them and make sure they have the right information and can manage whatever they're dealing with. So, again, a year later, many of the places that have cases have really good measures in place, and they quickly identify them, isolate them, and in a lot of cases prevent further spread. So that's key, and that's what we want, and that's what we're striving for.
Thanks very much.
Any additional questions from Blackburn?
No, thank you.
Great. Thank you, everyone. Have a great day.